Hello everyone, welcome back to the channel again. My name is Kobby. Today we are with Esmeralda Health and Tourism Agency and we will be talking about hair transplant today. Welcome to Kobby TV.
Thank you.
My name is Kobby. What is your name?
Yes, my name is Toygar, Dr. Toygar.
Toygar.
Yes.
Toygar, wow. We've been here before, this is not the first time. So we decided to pay you a visit again and talk about hair transplant today.
Yes, I see.
How long have you been doing this?
Almost 10 years now.
Really?
I'm practicing this plastic surgeon as a plastic surgeon and hair transplantation, yeah.
Wow.
It's time.
And 10 good years.
Yes, 10 good years.
That means the experience is much, you have much experience.
Yes, me and my team, I'm not doing the whole work actually, doing hair transplantation. We have several teams, so we can handle not only one, maybe 3 or 4 patients at the same time simultaneously, because it's a teamwork, not only one person can do it. So my team is actually more experienced than I have. They were doing this for almost 20 years. So I'm the new member of the team, but I'm the doctor, they're the staff. So
that's good. So is hair transplant the only option for hair loss?
Actually, no. You don't get to wake up bald one morning. It's a chronic problem. You start with losing some hairs at the beginning. You see some hairs on your pillow, and after a period of time, it's starting to getting open areas. Then becomes bald. So during the early stages we have several treatment options actually. As a doctor, what we can offer our patients is maybe PRP treatments. We take their blood and isolate the platelets part of it and inject it underneath the problematic area. Also we can do mesotherapies, which are vitamins to induce these dying hair follicles to come back alive and produce some hair. And also we can use some stem cell treatments to cure this problem. But none of them are 100% guaranteed treatment, of course. These are just efforts to stop the problem before it becomes baldness. But at some certain point we see that we don't get the result. It's that time we decide to do the hair transplantation, but of course we have some treatments. Other than that also, some kind of hormonal treatments are available, but I don't prefer them because giving some hormones just to keep the hairs there is too much of risk for a man. And also other treatments with shampoos and other topical treatments are available, but most of them are useless actually. The best one is the injections with PRPs, mesotherapies and stem cells. If you fail to achieve some results with that, the final answer is hair transplantation.
All right, thank you for the information. Can you answer this one for me? What are the different techniques for the hair transplant?
Yes, we have actually 3 different techniques we can use. Historically, the first technique we used was FUD, we called FUD. With this technique, we collect some skin sample from the back of our patients, surgically remove a skin, and our team starts to divide it and collect the hair follicles inside it. But it has downside. It will leave a straight scar just behind the head. With gentlemen with short hair, it will be visible. So right now we don't use that technique. The most popular technique is what we call FUE. With this technique we collect the hair follicles one by one from the donor area, sides or back of the head mostly. And also there's this last technique called DHI, which allows us to do the hair transplantation without cutting the hair actually. The first 2 techniques we have to cut the hair all, but with DHI we don't need to do that. We can take a long hair and implant the long hair, but we cannot say that these 3 techniques, one of them is the best one, the other one's not. No, it depends on the patient, it depends on the problem which we technique to choose. So for DHI, it sounds like the perfect technique. You don't need to cut your hair, but the thing is, the success rate of the implanted follicles are lower in this technique because it's really hard to collect the hair follicle without harming it. So there's a risk. When we prefer this method, if you are going to use hair transplantation for a limited area, small area, for example a scar, you can use the DHI method. But in male baldness pattern, if you have to you do
the big one,
a big area,
okay,
DHI is not a good method. It's too much time consuming method and the success rate is lower, and actually it's way expensive than the other techniques. So we decide on every patient which technique to use, but the old techniques are available here.
Okay.
Yeah.
Okay. What are some of the different steps of hair transplants?
Yes, let me explain about it. The old techniques have the same steps.
Okay.
It's the same for every technique. So at the beginning, we of course take the patient, take the photos, and do our planning. What to do about the hairline, how many follicles do we need to cover the whole area, if we need to do this hair transplantation in one session or divide in two different sessions, because in some cases, severe cases, we have to split in two sessions because you cannot plant more than maybe 5,000 follicles in one session. If you try, you can hurt the skin too bad, it will cause some scarring. Wow. So first we decide that. We take the photo, we do the planning, then we put some injections, tiny injections to numb the area. Afterwards, we start opening these channels to collect the follicles, then we collect it. Afterwards, we take a break, the patient takes a break because it's a long process. Then afterwards, we start opening new channels to put the collected follicles inside, and the final part, we put the follicles inside. Okay. There are lots of tricks during these times, during these steps. For example, you don't get to open the channels directly with direct 90-degree angles. You have to adjust the angles to achieve a natural look after the procedure. After a period of time when the hair grows, everybody wants a natural result with their hairs. So these are the basic steps of this treatment. This whole procedure takes around maybe 5 or to 7 hours in total. The most problematic part for the patient is the waiting process, lying on the table for 5 to 7 hours. Just that. It's not a very painful process for the patients, and not during the procedure itself. Also, afterwards, no pain at all.
So how long should a patient stay in Istanbul for this procedure?
So the patients should stay in Istanbul at least 1 night, 1 to 3 nights we can say. First day, when they arrive, we do the procedure. It will take 5 to 7 hours. Then we send them back to their hotel.
Okay.
And the day after transplantation, we want the patients come back. So we have a bandage behind the hair, the donor area. We can remove the bandage. Okay. And afterwards, actually, they are free to go. 1 night maybe sufficient for this patients, but most of the time we have some delays after their flight. Then in that case, we have to see the patients stay here for 2 nights.
2 nights.
Yeah.
So it's like 1 to 3 nights.
Yes, 1 to 3 nights is more than enough.
All right. All right. Then it doesn't take long.
Yeah, it doesn't take long.
It doesn't take long. Okay, doc. Let me ask this one too. What should a patient expect after the surgery or the procedure? Sure.
This is a long process after the treatment actually. So what we do is actually an organ transplantation. We should consider it as an organ transplantation because you take a living hair follicle cell and implant it elsewhere. Sure. So after the transplantation, the patient will see the hair we transplanted, and after a couple of weeks they will see that those hair are still growing. So they felt that this will be the final result. Okay, now I have hair, it will grow up. Sure. But the thing is, it's not the fact. after first month, they start to lose the hairs we transplanted. Most of the patients. Some of them don't experience this. They just grow like nothing happened.
Okay.
But most of the patients experience hair loss. In some patients, they lose all the hair we transplanted. This is something like that. When you get your finger between the door, you felt that it hurts, but after a period of time, your nail falls off. But the thing is, after a period of time, your nail grows back.
Yeah,
this is something like that. When we put the hair follicle from here to here, we cause some trauma to the hair follicle itself. So, hair loss after first month is totally normal.
Okay.
We expect the new hair growth around third month. It starts after third month. I don't say we see the final result at the third month.
Okay.
In some patients, we see any improvement after 5 months. So, just to be precise, I always tell my patients, we see the final result at the end of the year. Worst case scenario.
Okay.
This is the worst case scenario. Wow. In most of the patients, we see improvements after third month. But we never touch a patient within the first year. First, we have to see the final result at the end of the year.
Really?
Yes. It's a long process.
Really?
Patients need to be patient about the process. Rarely we see this kind of patients who get the result after 1 year. Most of the patients will see some kind of result between third or fourth month.
Oh, okay. All right, Doc. Thank you very much for this explanation. I really enjoyed the conversation today.
It was a pleasure for me. Actually, thank you for having me in Kobby TV.
You're welcome, Doc. You're welcome.